Well, vaccines for those as young as 6 months old begin today at CVS Minute Clinic locations. If you choose to get your young child vaccination, here's some of the options you have. If you go for the Moderna vaccine, it would be 2 doses, 1 month apart, with an optional 3rd dose for children who are immunocompromised. If you go the Pfizer route, it would be 2 doses, 3 weeks apart, and then a 3rd dose 8 weeks after the 2nd dose. And joining us now, once again, Dr. Syed Hussain from Trinity Health of New England to talk about this rollout. This has been the first question I think we've asked at least the past 3 or 4 times we've had you in here to talk about when is it happening, when is it happening. Now it is. What kind of a moment is this in the fight against the pandemic?
So good morning, Tim. Thank you for having me. It's a very historic milestone. This is the last group, the last demographic in the country now to get the green light to roll up their sleeves and get the shots. So it's a very big moment for all of us.
And just what has the disease burden been on that age group? We know they are, because this is such an age-dependent disease, they are by far the least likely to be afflicted, but that doesn't mean it doesn't happen. There's a difference between percentages and raw numbers with a disease that's as contagious as COVID is.
So granted, it's true that this particular age group has not seen the amount of severe disease, thankfully so, that we've seen in the older population. But however, we've still seen children, a record number of children hospitalized during the Delta wave, for instance, across the country. So it's really, really important that we protect our children from a virus that really doesn't know any better in terms of age, demographics, etc. When we have effective vaccines in our midst.
And you got parents out there who may say, well, I'm fine with getting the vaccine, but it's understandable that parents would be far more cautious with their little ones. And therefore, I think there's worry they're going to be far more hesitant to get their children vaccinated. How do you start countering some of the common worries that you're probably going to hear from parents?
So it's important to share the data. We are a data-driven society. That's where we need to move towards. There is hesitation, understandably, but talk to the pediatrician for your child, for your children. Look at the data, make an informed decision, because we don't want any child, for that matter, when we have safe and effective vaccines, to suffer long-term or severe consequences from COVID-19.
A question I had, parents who have a 4-year-old who are going to turn 5 relatively soon. It's a different dose. It's a different dosing schedule. What would you say to a parent in that situation? Should they wait, and maybe if they want to get their child more protected, or if they're worried, do they go for the smaller dose now as recommended?
Now that we know that we have BA4, BA5, Omicron subvariants gaining ground, which are far more contagious than previous variants, I would say do not wait. Get your child at least the first dose of the vaccine, and then if they're at that threshold, discuss it with your child's pediatrician.
All right, let's also talk about Paxlovid. That's been in the public consciousness for a while now as a good treatment, but are we getting a better idea of who it's best suited for?
Yes, great question. So it's best suited for those that are unvaccinated, highest risk for developing severe COVID-19 disease. There was new study data that Pfizer released a few weeks ago, which basically showed if you're lower risk, the chances of preventing more severe outcomes is minimal. There's no real benefit, so the study actually stopped early, which basically means unless and until you're a high-risk individual, and by that I mean obesity, medical comorbidities, underlying cardiovascular or pulmonary issues, then you're probably not going to be a candidate. You're not going to benefit from what the drug actually can offer.
Can I assume age is one of those conditions?
Absolutely, above 65.
So there you go. And that should hopefully alleviate any burden there might be with trying to get Paxlovid out to the people who need it. Dr. Hussain, thank you so much for joining us again to take the time to give us your knowledge.